everyone, welcome back to my nursing channel. So today I'm going to explain about what other documents is needed for you as a nursing student to do placements in here in Australia. So as someone who has done multiple placements so far, so I'm going to give you like a quick rundown of what are the things that you need. Okay. So the first thing that you need is a police check. That is a mandatory document you need. Either you can go for a volunteer or employee. I basically did the employee one, which cost me like around 50 to 60 bucks, and that's the most important documents you need. The second one is working with children check. It's gonna cost you around like $100, 120. I'm not sure. It's been a while that I have done it, but this is one of the document that is like a mandatory document as well, that HCare asks for when you are starting out. And there are a lot of immunization that you need to do, like vaccines, like for vaccines for tetanus, vaccine for MMR, or vaccines for varicella, influenza. So influenza is a vaccine that you have to do every year. And there are Hep B, like Hep 1, Hep B. There are like three Hep B vaccination that you have to do. And TB screening check, either if you have TB or not, X-ray, and there are like manual handling, CPR. So these are the documents. Like there are a lot of documents here that you need to repeat every year, and you have to pay and or go to the actual place to do the training. For example, first aid lasts for around 3 years, CPR lasts for 1 year. So you have to do it every year. You have to renew the documents, and you have to pay certain amount of fee. Like for first aid, it's around cost like $100. For CPR, maybe like 40 or 50 bucks. So it depends on what documents you are doing. It's gonna get pretty expensive if you like sum it up all, uh, but it's fine. And then you have to do hand hygiene you have to do every year. The first aid, I said, it lasts 3 years. And you have blood safe certificate. So it's a different one, but the documents that I said, like police check, like all the vaccines, influenza, MMR, Hep B, TB screening, working with children check, hand hygiene, manual handling, and CPR. So these are the documents that you need at the first placement in aged care. But after eventually you grow up, and then you start going in other placement, they will start asking for more and more and more. But it's all about like a layer that they formed, because there are a lot of skills that you learn throughout the way. And as you grow more and more throughout the process, they will add up more and more documents to it, and you have to follow it. Otherwise, what happens is, like, if you start to collect the documents at the end, then it's gonna, it's gonna get really difficult for you. So that's why they always, before they start of the nursing career, they always tell you guys to like start, working on your documents, because police check cost police check take like 2 weeks. NDIS is something that I forgot. So NDIS is also very mandatory document that they ask. Like, NDIS takes almost like 4 weeks for you to get it. Children's check takes time. So that's why these are the documents that they ask me for an aged care placement. But as I progress through in my like second year, they kind of like start adding up more and more, so that I have to add more and more documents to it. But if you have any queries regarding documentation, or what are the documentation that we need for your placement, or how to get it, like if you don't have any idea, if you're living in Australia and if you don't have any idea on how to get those documents, then you can just write in the comment section. I can get back to you, and that can be a one way I can help you guys. But pretty much these are the documents that they normally ask. They don't go beyond that, but in case if they do, then you can hit me up for sure. And I think that's pretty much it for now. So thank you very much for watching.